All right, welcome everyone. We are doing our next coaching call where we are going to just work through a bunch of different topics and questions and ideas that we get just from our experience in the office and kind of what questions that we're getting and things that we think are just going to be super beneficial for people doing chiropractic, red light program, just in general inside the office. Today, we are going to talk about urinary incontinence, pelvic floor health, our amazing Emsella Chair that we have, but more in general, why this topic is super important, different roles it plays, not just as it relates to incontinence, but as I found out and doing consults and seeing the benefits of the chair, like pelvic floor health plays a huge role in so many other parts of your body, parts of your life, parts of your relationships. I mean, overall pelvic floor, underrated,
Yes.
very, I think also, it's something nobody really talks much about.
Right.
And so that's what we're going to address today is pelvic floor health, the good, the bad, and kind of what you can do to improve that for yourself.
So when we talk about pelvic floor health, what are some of the areas that we see, how this expresses itself here in the office, as far as, people coming to us and they are moving along, in their treatment planning and, this comes up a lot, especially with red light therapy, especially with weight loss, because a lot of some of that excess weight can turn into some of these levels of incontinence, or what they think is. And actually, they're pretty much getting slammed. I feel so bad because I will say they get slammed so upside the head. I say it is just the perfect storm, because for me, I'm seeing it from this space of we went through this whole like perimenopause, menopause conversation a couple weeks ago, and they're really getting slammed because that menopause is lending to weight gain, but it's also weakening their pelvic floor, because anytime we as women go through a hormone shift at any time, it actually affects our pelvic floor. So knowing that, this Emsella has been really instrumental in addressing everything and not just one thing. Yes, it's one thing to take the weight off and the pressure off, but to actually address the laxicity in the pelvic floor.
Well, and chiropractically, what I'm trying to really integrate a lot more also is the same sorts of pre-existing issues that lend themselves to weakened pelvic floor are also going to be weak lower back, weak overall core, low back and disc issues, like all of the same underlying issues that will create pelvic floor and incontinence and some of the things that we'll talk about also lend themselves to, back pain and overall joint pain. It's also very important to address pelvic floor in correcting as we're addressing some of those things, because most people don't understand anytime I'm taking a step or I'm getting up from sitting, the way that muscles should be contracting and stabilizing and beginning to move, my pelvic floor, my core should be engaging first before all these other major muscle groups start to have to engage. And when that's not happening, when we have a weak pelvic floor, when we have a weak or a core that's not engaging the way that it should be, now we're using muscles the wrong way. Now we're putting stress on the spine the wrong way. And that's how we end up with injuries over a period of time. So same sort of conversation we want to start having, because there's, yes, incontinence is a major issue, but pelvic floor and core stability goes much broader than whether you have incontinence or you don't have incontinence. Because a lot of people have weak pelvic floor and weak core. It's causing other issues, maybe not incontinence, but this should be a conversation that everyone is really having and at least assessing. Yes. Measuring core and pelvic floor health and what that looks like. But I would say most of the time when we're beginning to have this conversation of pelvic floor health and weak pelvic floor, it is related to usually incontinence, prolapse, sometimes with men and sometimes with women for their husbands, right? ED and how pelvic floor is affecting that. So I would say those are kind of the three kind of most related conversations that we're having. Incontinence, there's really three types of incontinence. There's stress incontinence, there's urge incontinence, and then there's a combination of the two. So stress incontinence is when I go to jump or when I sneeze, right? When there's increased stress on bearing down in any way. Then there's coughing, laughing, sneezing.
Or if you're, if you've noticed too, like if you have noticed like hormonal shifting, it's like very interesting. Like you'll be going right along doing your normal workout routine, and then all of a sudden now with this, squat that I'm used to doing all the time, or even not being able to jump rope as long. That's where it showed up for me. Like it was definitely, I never had to watch the my time before on my jump rope, and then all of a sudden, but that was the mark for me too. But things like that. So laughing, but doing things you would normally do, and then all of a sudden now this is becoming right. Now I'm looking for a bathroom, or I'm I'm leaking a little.
Tons of different movements and exercises, right? It can be something yoga, Pilates, or clearly, right, a hip workout where you're jumping up and down and doing a lot more. So that's stress incontinence. Urge is, when I feel like I've got to go to the bathroom, I've got to go right now. Otherwise, or sometimes you're not quite getting there and there's leakage, or you can't control it until you get there. And then mixed is obviously some combination of both of those things, where certain things are going to cause some dribbling or leaking. Urgency is also an issue, and so incontinence, that's kind of what we're referring to, and how we gauge those things. And unfortunately, most of the people coming in, or we're having these conversations with, they've talked to their doctors, and there's not good medications out there for this sort of thing. Or it's really like, well, you're just getting older. This just happens. It's until you're at a point where you might need like a mesh or a surgery, which everyone wants to avoid that. You're really just kind of stuck with it until it gets to be an issue, because there's not a lot of good options to treat those until now, because we've had amazing success with the Emsella machine. But I would say right now that's kind of, it's mostly women who are having some kind of incontinence or control issues that we're mostly seeing right now.
So let's talk about the way that it works. So if you've never seen the Emsella, or you have never experienced it, so it is a chair that you sit on completely fully clothed. So this is non-invasive. It's very comfortable. We recommend using loose clothing while we're sitting on it, for sure. But what does it, as far as it using, is it electromagnetic frequency?
Yeah, so it's called high-fem technology. It uses electromagnetic impulses. So you're sitting on a chair and you're feeling almost like a tapping sensation. So it's electromagnetic, but it's not like you're getting an electric shock.
Right. And people also confuse this with like, they've asked this before, is this like using a TENS unit or is this like, and then talk to us about the differences in that too.
Yep, completely different. So that's the shock that I'm talking about. You know, like a TENS unit, it's applied directly to the skin. It is providing like an electrical shock. This uses electromagnetic, so it's more of a magnetic force than it is an electrical force. And so that magnetic force helps you to engage in muscle contractions in your pelvic floor. And what's amazing about it is it's doing a couple different things all at the same time. Number one, you're not having to think about it.
No.
Right? So when you are actively engaging and trying to do a Kegel, most of the time people have a hard time even knowing whether they're contracting the right muscles, firstly. Secondly, you're typically contracting a small percentage of the pelvic floor as you're doing that.
That's right.
And the level of contraction that you can get on your own is only 20 to 30% of a muscle contraction and what that muscle can actually, the force that muscle can actually contract. So what the chair allows is a broader range of recruitment. So the impulse is happening across a broader range. So we're able to get all of the pelvic floor muscles to be able to contract simultaneously. So we're getting the number of muscles increases. When your brain is telling those muscles to contract all at the same time, now we're reprogramming our brain to engage those muscles together instead of certain ones individually. And we're getting those muscles to contract because it's involuntarily at a much, much higher level than what you can get on your own.
So we're going from you can do it. We're moving towards doing 11,000 Kegels in 28 minutes at 100% contraction.
Right.
And we usually, typically, if we were really good at it and we knew what we were doing and we were top of our game at doing a Kegel, which I can tell you there's no way I was doing a Kegel the way that it was intended to be done before I sat on the chair and actually learned what that actually felt like. But us on our own, if we were really good at it, could only get to 30%. So this is giving us that 100%.
Yes, and it's the equivalent of that, right? So you're not actually, it goes through cycles as you're sitting there for 28 minutes. You're getting a series of contractions that happen, and then you're getting those muscles to take a break because we're doing a workout for our pelvic floor.
That's right. Well, we're really trying to lift, like give that pelvic floor a lift. Tell us what that looks like.
Yeah, so the pelvic floor, imagine a bowl.
Yes.
So as you get age, that bowl would drop or get deeper. And what the goal of this and what they've studied through their research is you'll actually see a lifting of the pelvic floor through a series of treatments because those muscles are beginning to tighten again. And so that's another kind of concept. Is just like going to the gym, right? Like while we're doing these sessions, we're actually breaking down muscle so that they can become and build back stronger. Now, typically because of the technology and the cycles that it goes through, it's flushing out lactic acid as it's happening so that you're not getting any kind of major soreness afterwards. There's no downtime to this at all. You can continue to do your workout, you can continue being intimate, you can continue to, anything that you would be typically doing, this is not going to interfere with that in any way. My experience has been, because I've done it myself is, yes, my pelvic floor will feel like I worked out,
right,
but it wasn't sore. It wasn't like I did a leg day where I can barely walk the next day.
Right.
I mean, there was absolutely nothing like that. And that's been the experience. I mean, we haven't had anyone come back and say that they've been sore or tender at all after being and engaging with the chair. So yeah, magnetic impulse, equivalent of 11,000 Kegels, because it's recruiting a lot more muscles all at the same time at a much higher force than what you're able to contract on your own. And that's, women love it because it's non-invasive. They're not at pelvic floor therapy where, someone is manually helping you to make sure that you're contracting muscles at the right time. And I think there's probably a time and a place for pelvic floor therapy, but the people I've talked to and my experience with people that I know has not been great with pelvic floor therapy. It's been really, it helps while they're doing the therapy, but then it is not a long-term lasting thing, because you're talking about muscles. You can't just go to the gym and do 6 workouts and then not feel like you're going to need to go to the gym again for ever, right? Same sort of thing. As that pelvic floor weakens and drops, the goal over basically 6 sessions is to raise that pelvic floor back up, get those muscles engaged. We have a huge percentage of people that see really significant improvements over that series of 6. And then depending on how much, where they started at and kind of what their goals are, then once we get the pelvic floor engaged and working again, then we either talk about maintenance, or then there's a protocol too that's talking about sexual health and more of a focused, deeper penetration to increase blood flow in certain areas of the body. So just depends on where someone is starting at and what their goals are, and that's where the practice comes in of actually let's talk about where you are and where you want to go with this.
Especially when we're talking about like these 3, the 3 different types of incontinence: the stress incontinence, urge, and then the mixed incontinence. What we're seeing in about 6 of those visits, in some cases, is somebody will come in and they're already wearing liners or they're wearing pads, and by the end of that, or even before the end of that 6th session, they're noticing that they're no longer needing that anymore. Things have really changed as far as their level of activity is concerned. They're noticing that, they're not thinking about it anymore as they're moving through their, daily workouts and things like that too.
Yeah, we normally start to see, because this builds, right? And so it takes time for those muscles to begin to break down and then begin to build again. And so normally by session 3 or 4, that's when people are really coming back and saying, wow, I'm really starting to feel like this is making a difference.
Yes.
After the 6th session, we kind of give it a couple of weeks and then we check in with them again. And by then, that's when we're really seeing kind of the maximum results that we're going to see. And then we have the conversation of, okay, where are we at? And do we need to do another round of 6? Do we need to work on different protocol? Do we need to talk about maintenance and, kind of working through?
Our men go to protocol 2 right away though.
Depends. So if they're having incontinence issues, we would want to do work on pelvic floor first, and either do like some of pelvic floor, some of protocol 2, or if it's really like, I'm not having issues, while they're with incontinence, then yeah, we can talk about just kind of starting at protocol 2. And even women who don't have incontinence, but they want to see, a difference in
their pelvic floor health,
health,
and sexual health
related to sexual health, you don't have to have incontinence to do the
right.
Emsella. We've had people who
right.
have just come and done it for
right. But we can't just shift to protocol 2. If you are experiencing a little bit of an incontinence, you can't just shift to protocol 2. But if that's not a problem, we've also had women come in and use it not for incontinence, but to use it specifically for sexual health.
Mm-hmm.
And namely things like pain in intercourse. Like it has really alleviated pain in intercourse for a couple of women that we've seen come through the office. Also helping, with blood flow, with lubrication, with things like that. So now addressing dryness and things like that. And it's made a pretty significant, difference in their relationships.
Oh, for sure. And that's, when we have somebody fill out the questionnaire, we're trying to gauge what direction do we want to go with these things.
Mm-hmm.
And I'm just really, for me, obviously I'm not a woman, but having these conversations with women about how much just incontinence, not even like the sexual health component of it, but just incontinence is affecting their lives.
Yes.
Is crazy.
You don't think about those things, but all of a sudden you're thinking through the cleanliness, and it's all of those
confidence.
Huge. Yes.
I think the most surprise that I've seen women, before doing the treatment and afterwards, has been confidence. Mm-hmm. Because to go from wearing pads or just not, having some leaking or dribbling through the day to not having that, that's a really huge deal to not have to worry about putting a pad on based on what dress you're wearing, or just feeling like you can be more spontaneous with your partner because of all these other factors, right? That makes a huge difference in how you feel about yourself and how you feel about your relationship and just overall quality of life. Right? That's a lot more. Or, hey, I just want to be able to go for a run and not have to map out where I can stop and go to the bathroom at. I can just go for a run. Those are really big changes that make a difference for people, and I love to hear it, and I probably don't hear, there's a lot of people who are doing red light and also do this, so you probably hear a lot more of some of those biggest improvements or changes. What one is there one that sticks out to you as far as somebody who's big change?
I think that's the one that was the most. I love it when women come in and they're just like, I can't believe I'm not even wearing, I don't even have to wear a liner. I don't have to wear pads anymore. We definitely get one of those. But I think the one that really hit home is again less. It was less that just being newly married and just the drastic difference, that's such a huge part of people's lives. I can't imagine not having, that, part of your life, especially when I hear women say this was actually so important to me. I think it's more of those. I have women who have completely lost all libido, and there's a difference, right, between desire and function, because they have the desire. It has nothing to do with that. It's just that feeling of, now I'm dealing with all this dryness. I can't be spontaneous. I'm dealing with all these other factors, and I might leak if we are engaging, and things like that. And just to be able to move through that and to give them that part of their lives back has definitely spoken volumes and volumes.
So if anyone is interested in hearing more about the Emsella, obviously or you have questions, because we didn't really get into pelvic floor and back issues.
I can't wait. We should have a part
that's
2 of this.
A really
because I really I love the way you
posture.
and to understand that, right? It's a big deal, and I love to like break down exactly how that works, because the second we start having pain, all of a sudden, you know, your whole body's responsibility at that point is to lock you down in its own brace to protect you, which means that all of a sudden there goes my core. Like it's gone. I have no more, and my brain has no way to engage that anymore. And just like you said, I can't wait to break more of that down.
Let's do that again,
2.
because absolutely. Because you're going to see it show up in very different ways. So sometimes you get too much muscle contraction, which, like, my back is tight and spasmed, and sometimes there's just a lot of weaknesses and posture issues that are going to show up with that. So absolutely, we'll talk about pelvic floor and core and posture and back issues and low back pain and hip pain, tons of that. If you're interested in getting a stronger and healthier pelvic floor for any of the reasons that we've discussed, certainly reach out. We're happy to give you a free demo on the chair so you can see what it feels like, because trying to explain what it feels like, there's no way to explain it until you actually get on there, and then it clicks. Oh my gosh, this makes sense. I can feel my pelvic floor engage in a way that I have never felt it engage on my own. And so, no, this doesn't hurt. I can understand how this works. So anytime one of you is interested in just doing a demo on it, we're happy to schedule that or put that in before or after one of your appointments. Big caveat to that is, and something that we're sure to screen for, is you can't have any metal implants. So no pacemakers, no defibrillators, no electronic implants, no drug pumps. Outside of that, pulmonary insufficiency. Certainly can't do it to really you're sitting on it, but no tumors, and you definitely can't do it while you're pregnant. So outside of that, super safe for everyone else, but we'll definitely screen you for those questions to make sure there's not going to be any contraindications, to make sure for you to be able to sit on the chair and test it out. Anything before we go and get into the week here?
I think that's a wrap.
Perfect. We'll see you next week. Again, if you have any questions on your pelvic floor health and how we might be able to help with that, just reach out or leave a comment in the comments below.